All right, let's dive into one of the toughest topics on the NCLEX, maternal and neonatal medications. If you're feeling tired of just trying to memorize endless drug lists, you are definitely in the right place. Now, this isn't a full-blown lecture. Think of it as a sneak peek, a look at a much smarter way to think, using the exam coach's framework to turn all those confusing facts into clear, confident clinical judgment. Let's get into it. And right away, we're hitting on the core principle here. Your success on this exam, it's not about brute force memorization. Nope, it's about really understanding the why and the when, that critical sweet spot where patient safety meets perfect clinical timing. And this is where the stakes get really high. We're not just talking about abstract facts. I mean, think about it. You miss one single sign, like maybe depressed reflexes while a patient is on magnesium sulfate. That can have huge consequences, right, for your patient and for your exam score. This is exactly where clinical judgment isn't just nice to have, it's absolutely non-negotiable. So, here it is, the key takeaway. The exam isn't just trying to find out what you know, it's testing how you think like a nurse. Can you spot a problem before it blows up? Can you figure out the most critical action to take first? Can you intervene safely? That's the exact mindset we are going to build right now. Okay, Section 1, the NCLEX Medication Challenge. We all know this is a tough area, but why? What is it that makes it so tricky for so many people? Let's break down the most common hurdles. Does this list look a little familiar? I bet it does. It is so easy to get tangled up in the details, mixing up the drugs that stop labor with the ones that start it, or memorizing a long list of side effects without knowing which one is the real red flag. And what happens? We miss those subtle but critical signs of patient compromise and get stuck trying to decide what to do first. And this gets to the absolute heart of the mindset shift you need to make. The exam is not trying to trick you with some obscure drug name. It is testing one thing and one thing only. Can you connect the dots? Can you go from the medication to the patient's response to the single safest nursing action you can take? So how do you beat that confusion? Well, this is where a structured framework becomes your most powerful tool. Forget about random facts all over the place. You need a system. Let's take a look at how Exam Coaches organizes this content to actually make it stick. It all starts with a simple high-level distinction. Tocolytics, they stop labor. Oxytocins, they start it. Just by categorizing them with this one simple idea, stop versus start, you create these mental buckets that prevent confusion right from the get-go. Sounds simple, right? But trust me, this is the foundation for everything that comes next. Okay, let's drill down into our stop category with a really high-stakes medication, magnesium sulfate. I want you to think of it as a central nervous system depressant with two critical jobs. It stops seizures in severe preeclampsia, and it stops preterm labor. And this right here is where the focus flips from what the drug does to what you do. These are your critical safety checkpoints. This is where you become the detective, constantly looking for signs of toxicity. Is her breathing slowing down? Are her reflexes getting weak or disappearing? Are her kidneys shutting down, which you'd see in her urine output? This isn't passive charting. This is active, prioritized monitoring. And boom, here's how the NCLEX tests that knowledge. You see a number, 20 ml an hour, which is way below the safe threshold. Your brain should immediately light up with potential magnesium toxicity. The priority action isn't just to write it down, it's to intervene to keep your patients safe. Okay, let's flip over to the other side of our framework, the start category. These are the uterine stimulants, or oxytocins. Their job is the complete opposite of what we just talked about, to start or strengthen labor, and just as critically, to control postpartum bleeding by forcing the uterus to clamp down hard. Now, with these drugs, the danger is the complete opposite. We're not worried about slowing things down. We're worried about overstimulation, things going into overdrive. A uterus contracting too hard for too long, that's a recipe for disaster. But here's the real trap you have to watch out for. After all that intense work, the uterus can become exhausted and just give up. And that can lead to a massive hemorrhage. You have to anticipate that risk. So in a scenario like this one, your first thought shouldn't be, what drug do I give? It should be, wait, why is this happening? Is the uterus boggy because it's just exhausted after oxytocin was used? See how understanding the medication's potential rebound effect directly guides your priority assessment? That's clinical thinking. Okay, let's pivot to a medication that isn't about starting or stopping contractions at all. This one is all about protecting the future. We're talking about Rho-D immune globulin, or RhoGAM. Its only job is to stop an Rh-negative mother from creating antibodies that could be really dangerous for her next Rh-positive baby. And with RhoGAM, safety is all about following the protocol perfectly. It's a precise checklist for a very good reason. First, are we absolutely 100% positive she's Rh negative? Second, and this is so critical, has she already developed the antibodies? Because if she has, giving this drug is pointless. It's too late. This is procedural safety at its absolute core. So this question just hammers that point home. Before you even think about picking up that syringe, your very first move is to check the chart. You have to verify her Rh status and her antibody status. It's the classic think before you act nursing principle in action. Okay, so we've looked at stopping labor, starting it, and protecting a future pregnancy. They seem like totally separate things, right? But now let's zoom out and see how a smart framework connects all of them into one cohesive way of thinking. This mind map from the guide shows it perfectly. Just look at how tocolytics, magnesium sulfate, and oxytocins aren't just floating out there as separate facts. They're all connected under one central idea: management. This is how you stop seeing them as isolated drugs and start seeing them as tools to solve specific clinical problems. So here it is, the unifying idea. Whether you're trying to stop labor, start it, or prevent Rh sensitization, the fundamental nursing process never, ever changes. You anticipate the risks, you monitor for the first signs of trouble, and you intervene safely. That's the loop. That's the job. All right, let's bring it all home. Mastering NCLEX judgment. Because at the end of the day, this isn't just about passing a test. It's about building the kind of real-world clinical judgment that the NCLEX is designed to measure in the first place. So at Exam Coaches, we don't just teach you the side effects of magnesium sulfate. We train you to recognize the signs of magnesium toxicity. We don't just give you a list of nursing actions. We train you to determine the single most important intervention when uterine hypertonicity hits. Ultimately, this isn't about memorizing facts out of a textbook. It's about forging that confident, decisive thinking that truly defines a safe and competent nurse. And I want you to take this with you into the exam. The NCLEX is always looking for the best answer. And that means the action that is not only correct, but is also the fastest and the safest thing to do in that exact moment. That is the essence of clinical prioritization. So this was just a quick peek through the keyhole. The complete framework that connects all of these medications to the clinical conditions you're going to face is waiting for you inside the Exam Coaches platform. The question isn't just about what you can memorize. It's about how you can learn to think. Thanks for watching.